Strategy number 9. Decode NCLEX questions. If you're having trouble with test-taking skills, practice decoding NCLEX questions. Here are some tips on how to read an NCLEX question. 1. Always make sure you understand the question. Each question contains patient information and may contain qualifiers or distractors in a question stem. 2. The patient information, i.e., a client with COPD, a patient with NSTEMI, can help guide you to the topic of the question. This gives you a hint about the body of knowledge you may need to consider, but is different than what the question stem is asking. 3. Qualifiers are words that add meaning or context, i.e., the priority nursing action, care of the post-operative client, etc. They might not jump out at you, but don't miss them. Qualifiers can differentiate one answer choice from all the others. 4. Distractors may or may not be present. Sometimes we even make them up by reading into the question. Distractors are bits of information we don't need to apply in order to answer the question. 5. The stem is the part of the question that tells you what the question is actually asking. The stem is often at the end of the question, but not always. The stem directs you to the type of answer choice you need to choose. 6. The stem and any qualifiers together will identify the correct answer choice. 7. The first time you read a question, read only the last sentence. This is usually the stem. This is often a stripped-down version of the question, directing you to the type of answer choice you will be looking for, i.e., what is the priority intervention? Or, what client will the nurse see first? Identify the type of answer choice you need to find. 8. Eliminate unsafe options or non-therapeutic responses. Next, read the whole question, and then stop. Ask yourself if you can guess the answer before you read the answer choices. Do you know this already? Do you remember this from lectures or your readings? Did you see it in clinicals? Can you make an educated guess based on what you know or understand about a similar condition or example? 9. Next, read the answer choices. Eliminate answer choices that use never or always, or any answer choices that have very similar meanings. They can't both be right, so they must both be wrong. Narrow it down to your best guess before you reread the question stem. 10. Compare the question stem to your answer choice. Does it match any qualifiers in the question? Does it make sense? Make sure your selected answer actually answers the question.